Good morning. My name is Connie McLaughlin, and I'd like to welcome you to today's webinar on unusual incident investigations. With me today are Kathy Bline, Regional Manager with the Ohio Department of Developmental Disabilities, and Scott Phillips, the Assistant Deputy Director from the Ohio Department of Developmental Disabilities MUI and Registry Unit. Welcome, Kathy and Scott.
How are you?
Hi. So before we get started with today's presentation, we wanted to go over a few housekeeping items. First of all, everyone that is logged on to the computer today will get credit, obviously, for participating in today's webinar. There are handouts available. If you registered before yesterday evening, you would have received those with an email. There were many handouts, and we will make those available through the Ohio Department of Developmental Disabilities website and the Health and Safety Toolkit. Some of them are posted here through the GoToWebinar system. So if you haven't received those, feel free to download them. They're a copy of today's PowerPoint presentation and some other handouts. In addition to that, we would like today's presentation to be interactive. So please feel free to type in questions or comments as you have them. Because we have a very limited amount of time today, if we don't get to all those questions, we will certainly provide them to the group with responses after today's webinar. Sometimes we know that people experience issues with the audio when participating. Oftentimes people log onto their computer, obviously, so they can get credit, but then also listen via their phone. And so if you're having any issues with audio, we first recommend that you go through and adjust your speakers. You may need to turn your speakers off on your computer so that there's not some background noise. And if that doesn't resolve the issue, we would recognize or recommend that you go ahead and disconnect and call back in. You will still get credit for participating if you do that. So everyone that participates today, either viewing as a group or by logging on to the system, will get 1 hour of credit. Within the next 30 days, you will get a certificate emailed to you at the email address that you provided. There's a group attendance sheet that is downloaded in the handout section here for you. If you are attending through a group, that means more than just you, please complete that form by typing into the Excel spreadsheet and then forwarding it to our office at the email provided on the spreadsheet. If you have any questions, please feel free to call our office at 614-995-3810, and someone should be able to assist you. Now I'm going to turn it over to Scott for the next part of our presentation.
Thanks, Connie. Good morning, everybody. Thanks for being here today. I know you all are very busy, and I appreciate you taking some time out of your day to spend with us to talk about UI investigations. I guess just a little bit of background before we get going. I think many of you know that we had a change in the rule, the MUI rule this past year that really kind of changed the neglect definition a little bit of an MUI. And as a result, there are several incidents that would have been reported primarily as an MUI prior rule that are now reported as a UI through the program implementation piece of the MUI rule. So that's the UI investigation piece that really we appreciate providers and the stakeholder group involving providers talking about and taking on more ownership and conducting those investigations. And is a real driving force behind why we wanted to do some education and provide some follow-up. To let you know kind of what the department's been doing, we have conducted 5 different meetings on UI investigations face-to-face. We've done some training on UI investigations at OPRA. We've talked about it through our regional meetings that we've held through the department, and obviously conducting this webinar today to make sure that we try to get information out just to really improve the quality and the outcomes associated with unusual incident investigations. So some of the stuff we're going to talk about today, we're going to talk about your different roles. I know we've got a wide range of folks on the call, so to talk about the different roles that people play in the health and welfare process. We're going to talk about why investigations or UI investigations are so important, and they truly are. We're going to do some definitions, talk about some definitions of UIs, and then we're going to walk through the process of a UI report, what immediate action should be taken, steps for that investigation piece, and then follow up with some additional UI requirements as we go throughout the day. So that's kind of the goal for us in the discussion for Connie and Kathy and I today. First of all, I want to start by saying everybody on this call is an advocate. You're an advocate. You're important in somebody's life. You're a key person in protecting the health and welfare of some very vulnerable folks that we support. So, you know, your role is to report, to help in prevention, to help protect those folks continually throughout the day, to provide good investigations, and also to communicate well. And I guess I can't emphasize enough the importance of communication. Ohio has a terrific system for protecting the health and welfare of folks. That system's only as good as what's reported. You can have the best system in the world. If we don't report well, if we don't follow up well, we don't do a good job of protecting people. So everybody on this call is an advocate, and certainly we thank you for the work that you do, and we know that as a result of the information we're going to share today, we'll continue to improve the quality of services that we provide. And definitely, it's more than a critical incident report system. It's a health and welfare quality improvement process, and I really want everybody on the call to know and to share with your folks how the incident reporting system in Ohio, how important it is in protecting people. And it's a good thing. It's something that we want people to report. We want folks to follow up and to check into those things and make sure that people are healthy and well and that we're trying to prevent things from happening. So every time you get a UI or you follow up on a UI, you're helping to make sure that we improve and we protect people. And by having a good UI system and a good MUI system, we're certainly improving outcomes for folks that we support. In addition, I wanted to walk through, this is it walks through the steps of our health and welfare process, whether it be an MUI or a UI. You've got that incident reported. You've got immediate actions that have to be taken as a result. You got that investigation piece that we initiate and we look into, and we really try to figure out what happened. And that helps us to identify cause and contributing factors. And then if we do a good job on the front end there, then that prevention plan that we put into place is going to be something that really helps to keep that from happening in the future. And that really is an ideal situation when you think about quality improvement and health and welfare outcomes for the folks that we support. This particular set of boxes really emphasizes the quality improvement loop that you guys see a lot of times. It's that big circle that we all deal with. So I think that the current state, and I'm excited now that the current state of situations for us, we've had neglect MUIs. MUIs reduced about 30%. And in doing so, that means that providers have stepped up and picked up responsibility for those things prior to the new rule that are being reported now as UIs, which means you guys have gained about 30% that you're looking into. And that's why it's so important that we talk about UI investigations, we think about what really goes into them, and we make sure that the outcome that we have is really what we're after. And that's what this whole presentation is really about today. And I'll tell you this, we feel like providers of service in Ohio do a really nice job of doing UI investigations. The reason we're doing this training is to try to really make sure that everybody has the skills and abilities and opportunity to share information to make it even better. And I think that's what we can do, certainly as a result of this investigation piece. All right, and I think I'm going to turn things over back to Connie to talk about the role of the provider in the process.
Thank you, Scott. So as Scott mentioned, obviously your role in doing UI investigations is critical, and it doesn't matter whether you're an independent provider, you're a direct support professional, you're an agency administrator, a service and support administrator. All of you play an important role in this process, and it's all about quality improvement, and it's all about prevention. So we're going to start off just basically going over some of the key critical roles that you have in this process. And the first and the foremost one is providing immediate actions to the individuals that you support and making sure that they're safe. So we all know that things are going to happen, that's life, but making sure that once we identify an issue or concern or an incident, that we're taking immediate actions to make sure that person is safe. And that might be taking someone to the doctor, consulting with a pharmacy, getting first aid or medical care. There's a whole list of things that you do every day to make sure that the people that you support are safe. And so those are the things that we call the immediate action. Following that, once the person has been safe or the people have been safe, I would definitely say that you would need to make sure an incident report is written. And we all know that conducting a quality investigation starts with an incident report. So make sure that your incident report provides very good information, detailed information about what happened before, during, and after that incident. And we want to make sure those incident reports are legible. We have some examples of ones that we will provide to you so that you can do staff training. Notifications is another big piece of this process. We want to make sure that everyone that needs to know about this incident has been informed so they can take whatever action necessary to better support that individual. The notification process is a little different for independent versus an agency provider, but those are listed here for you in the MUI rule. The other thing, and probably very critical to this process, is really drilling down to find out what caused and contributed to the incident so we can make sure that the prevention plan is effective. So unless we really know why something happened, we're never going to get at preventing it from happening. We could take a lot of actions, but if it's not really remedying the situation, then it's not going to be effective. The other role that you play is completing a UI log. Again, whether you're an independent or agency provider, you're required to complete an unusual incident log every month. You're required to log all the incidents that are the UIs that happen for people that you support every month and review them for patterns and trends. And then in addition to reviewing them for patterns and trends, if anything's identified, you need to take action to kind of remediate that. So if you notice that Kathy has a pattern of falls, whether that's 3 falls in a week or 5 in a month, then you need to get together with the team to address how the team thinks that we should work together to better support that person that's experiencing that trend. Finally, you're required to send in UI logs to the county board upon request. The county boards are required to do a random sampling of all providers within their county. So if you have a county board that requests either a UI log or one of your investigations that you've conducted, you are required to provide that to them. Again, this is all in an effort to better support the individuals that we serve. And then finally, one of the key pieces to this process is making sure that any risk associated with MUIs or UIs in this factor are being addressed in the person's plan. So if we know that a person has significant risk around choking, then the plan should have supports in that to address that person. Again, we don't need to spell out in the service plan whether someone has had 4 MUIs or they've had 4 unusual incidents. We need to address the risks that are associated with either of those. So those are kind of the key critical roles of the provider in the UI process. Next, we're going to move on to what the definition of a UI is. And this is clearly spelled out in our administrative code, which is 5123-1702. And so if you ever have any questions about the rule, you can go on our website and download a copy of the rule and some supporting documents and guidance around that. In terms of defining unusual incidents, this definition really did not change much with the new rule that went into effect January 1st of this year. What did change, or we added a couple additions. So we'll go over really quickly this rule. So an unusual incident is basically an event or occurrence for an individual that's not consistent with routine operations, policies and procedures, or the individual's care or service plan, but is not an MUI. And the examples that are listed within the rule here are all considered unusual incidents. And we'll go through those. But just to clearly state this, anything that's bulleted out here in the next 2 slides and within the rule, we would expect to see an incident report for, an investigation for. We would expect you to look for cause and contributing factors and develop a prevention plan. And anything associated risk with these types of unusual incidents, we would expect that you're addressing with the team. So again, anything that is bulleted here is considered an unusual incident, and we would include dental injuries, falls, and again, these are things that are not MUIs. So an injury that's not a significant injury MUI, but is an injury nonetheless, we would expect to see an incident report. When there's medication errors without a likely risk to health and welfare, there's an overnight relocation due to a fire, natural disaster, mechanical failure. If there's a peer-to-peer incident that doesn't rise to the level of an MUI, a rights code violation, usually without a likely risk to health and welfare. When there's an unapproved behavioral support without a likely risk to health and welfare, those are all considered unusual incidents. And finally, the two additions to this definition are the emergency room or urgent care treatment or programmatic implementation incidents. So now with the addition of these two in the January 1st, 2019 rule revision, we would expect to see an incident report for any emergency room or urgent care treatment visit and every programmatic implementation incident. The definition for programmatic implementation is when there's an unusual incident involving failure to carry out someone's plan, and that failure causes minimal to no risk. And this is a big change that happened within our rule. And again, this is what Scott was talking about when he said there's about a 30% reduction in the filing and investigation of neglect MUIs, because those things are still occurring, but they're just defined and investigated differently. So instead of a county board investigating those, there's an investigation by the provider. So we still think these things are important. We still want to focus on prevention, but they're just being dealt with a little differently than before. So most programmatic implementation incidents are what we would consider lapses of supervision for short periods of time when there's little to no risk to the individual. And other examples might include when there's an automobile accident without harm, and it's just an accident. There's no, the staff wasn't driving intoxicated or impaired or anything like that. It was just an automobile accident with no harm. We've provided a couple other examples here where, again, a staff may have reported falling asleep, but there was little to no risk to the individual and they suffered no adverse effects. Again, these other examples are really what we would consider minimal lapses of supervision, little to no risk to the individual. The one thing that I want to point out here is that it really depends on the risk for the individual, and we all know every individual is different, and we would get that information by knowing the person, what risks there are for them, and what their support plan says. So a minor lapse of supervision for someone, for one person, may not be that big of a deal. However, if there's a minor lapse of supervision for someone that has very critical medical needs and needs constant monitoring, that might rise to the level of a neglect MUI. So really, we need to know the person. And so when you're consulting with the county board, whether you think something might be a programmatic implementation UI or a neglect MUI, it's important that you provide as much information as possible to make that determination. If you ever have any questions, please don't hesitate to contact your county board or our office. We're happy to talk with you and discuss it, talk about the person's risk and how we should move forward to best investigate that and work on prevention. As we've stated before, pretty much the most important thing we can do in any incident, whether it's an unusual incident or an MUI, is provide immediate actions to that individual and anyone else that may be impacted. We want to make sure we're checking for injuries, calling 911, initiating first aid, whatever needs to take place to make sure that person is safe. Before we do anything else, that has to come first. So we know there are things that you do on a daily basis to make sure the people that you support are safe, and we want to make sure that you're documenting those. Oftentimes what we see when we're reviewing incident reports is there may be lacking information, and it's not because the provider hasn't taken that action, it's because they haven't well documented their actions. So please take some time after you've ensured immediate actions are taken to write a well-written incident report and to make sure that every action that you've taken as a result of that is being documented so that you can demonstrate that you've done a complete investigation, that you've taken all the steps that you need to ensure health and safety, and that, you know, we've really worked on preventing those things from happening. In terms of unusual incident investigations, we're really trying to determine what happened and why it happened. And Kathy is going to talk here shortly about root cause and what contributed to incidents. But really, that's the crux of these investigations, is finding out why they happened so we can minimize the risk, not only for the individual, but for the staff person supporting them, for the agency. If we can minimize the risk for everyone involved, we're all going to be much better off for it. And then, like Scott said, this is a quality improvement process. So we're focused on quality outcomes for the individuals we support. This isn't supposed to be about blaming people. This is supposed to be looking at what happened, why, and what we can do to better support everyone involved. And so it should be focused on quality outcomes. And now I'm going to turn it over to Kathy, and she's going to talk about the steps for conducting UI investigations.
Thank you, Connie. Hello, everybody. So when you do the investigations, I don't know if some of you that are here have done MUI investigations, or you primarily have just done the UI or vice versa, but whether it's a UI investigation or an MUI investigation, it's still important. They're both equally important. The better we can investigate a UI, our hope is not to have it progress to an MUI. So it shouldn't be, well, one's more important, so I'm not, or the UI investigation is not as important. So you don't want to kind of get stuck in that. When you start an investigation, the very first thing you're going to get is the incident report. When you're reviewing it, if you're the person investigating it, make sure that you're seeing that the incident report talks of everything here that's on the screen. Who was involved, what happened, when did it happen, where, who was involved, what was going on prior. Oftentimes that what happened prior can help with identifying the contributing factors. So when I would do investigations, I would look at the incident report, and sometimes we know the incident reports are not all that detailed. This is a great opportunity. I would use this as an opportunity to teach that staff, because the next time, if I just fix that, or I, kind of fill the blanks in for them, they're never going to learn, and the next time is going to be, just as bad or not as detailed. So use this as an opportunity to teach the staff, hey, okay, this is where we want to add this, and we want to get more detail, so he or she knows what to do for the next time. When you start your investigation, you get the incident report, you find out what happened, who do you need to talk to. We want to immediately start looking at documentation. If you're the MUI investigator, I know this is UI stuff, but let's say you're an investigator, you don't really know the individuals. The first thing that most investigators would do is to find out who this person is. We're going to gather an ISP, we're going to look, we're going to assess it. Maybe we need, a MAR that we got to look at if this is a medication issue. Staff notes, anything that's going to help you to put all the pieces together so you can have a very good picture of what happened. Review those documents. I personally like to gather those and make copies of it and keep it with this particular incident report investigation, because down the road, I'm not going to remember always exactly what happened on this day unless I have everything there. Maybe my investigation is complete, I have all the documents in there. So I recommend it. You're not required to do it. But in 6 months down the road, if an investigation happens and we have to refer back to this UI investigation, it's going to be a lot easier for everybody involved if you have everything in a nice little package there. So it's whatever you want to do, but that's a high recommendation. So training records, if you need anything that you might be relevant to that particular incident. Okay, so let's say you get the incident report, you start reviewing things, and then all of a sudden you realize, uh-oh, this is probably an MUI now. It's kind of escalated to a higher level because we found out more information. Don't panic, just stop what you're doing, call the county board and consult with them, and it's not a big deal, because sometimes we don't know immediately because every MUI starts out as a UI, so the incident report always has to happen, and sometimes we don't know all the ins and outs at the very beginning until you start digging in, and that's okay. But just once you realize this is an MUI, you need to stop and call the county, and because at that point it becomes an MUI, and the investigator, whether it's the county board or the COG IA, would need to do that investigation. So, okay. Now what happens is you realize this is not an MUI, you're going to continue, we're going to start conducting interviews. You really need to make sure you interview everybody that potentially is going to have information about the incident. One of the big things that we want to focus on is interviewing and talking with that victim or the individual that's involved, regardless of what we think maybe this person doesn't, vocalize, like that they can tell you what happened. It's very important that we spend time with that person minimally to let them know that somebody is involved, that what happened to them is important to us, and we want to try to help them. We have absolutely no idea what people understand always, especially those who maybe communicate different with their vocalizations or gestures or whatnot. So it's very important that we don't overlook that individual. Sometimes we have to talk with other peers, sometimes it's staff, medical personnel, or family members. So when you want to gather as much as you possibly can, so that way you can get a very good picture. So after you've done all the interviews, you've collected your documentation, you now want to go out and make sure you do any scene assessments or take photos. If somebody has an injury, a cut, we want to take a picture of that injury. We had a situation one time where somebody had a bruise. There was some confusion on had this bruise been reported or not. And a new staff came in like a day or two later, noticed the bruise and said, hey, has this been reported? Oh yeah, that was reported. But 2 days later, the bruise is significant, it's huge, and it was unclear that this bruise that started 4 days ago was the size of a quarter, and 4 days later it's the whole bicep of her arm. So take pictures, talk about things, look at your provider policies in regards to picture taking, what you're supposed to do or not do. I don't want to, say something that you're not supposed to be doing, but it's always a good idea to take a scene assessment. Maybe if there's blood on the pillow, we want to take a picture of that blood on the pillow, so it kind of makes sense. Also with the scene assessments, especially for providers, you're going out to do a UI investigation. Most of you know the layout of the house or the day program or wherever this incident's going to happen. So let's say somebody fell and they hit the dresser next to their bed, and you automatically know that there's no dresser. So, but you don't know, maybe they moved the dresser there the night before. So it's very important that you go out and assess that scene to make sure it's going to make sense. Once you receive everything else, you're going to review all the facts. Does the injury match what was reported? Are the interviews consistent with what was documented? Things like, if you had, say, somebody has a bruise to the back of their neck, does it make sense of how somebody's reporting it happened? That also goes back with the scene assessment and photos and whatnot, in addition to your interviews. So be very careful here. We're talking about incident specific and not based on historical information. When you review your facts, it's really important that we try not to look at this person's history. Be very careful of our bias, whether it's a staff bias or an individual bias, meaning this is an individual who has a history of false reporting. He always false reports. It's never happening. We automatically have that bias going into this. This is probably not true. It's really difficult, especially if you know the person, whether it's the staff or the individual, that it's hard not to go there in your brain, but it's really important that you try to be very specific to this incident. So I don't care if somebody could have been a false reporter 99% of the time. Those are the people oftentimes who are going to be re-injured or abused because no one's going to believe you anyway. So you have to be very cautious. I had, in one of the cases I used to do years ago, I had the lady at the provider that's like, staff was accused of something, and she's like, there's no way he did it. I know this guy, he wouldn't do it. But the problem is she wasn't there, and actually he did do it. So be very, very cautious of that, that you're not putting your own bias into it. Look at the facts, look at the evidence, and then you support, whether or not something happened or not. Okay, so now we get to contributing factors. You've done your investigation, you've talked to people. Now we got to figure out why something happened. When sometimes people do cause and contributing factors and they say, well, they kind of recap what happened. We already know what happened, but why did it happen? And on this particular screen, it talks about a cause is a condition that produces an effect. If you eliminate the cause, you eliminate the effect. And then a contributing factor is something that influences it. So when you look at the incident, try to figure out, ask yourself why something happened. If you can get to why 5 times, oftentimes you're getting to the root cause. So let's say somebody fell while using a walker. If you ask, well, why did he fall? Well, the wheel got jammed up and he lost his balance and fell. Well, why did the wheel get jammed up? Well, the handbrake was stuck. Well, why did the handbrake stick? And then you get into, maybe you find out that it was broken and it wasn't fixed yet. Well, why wasn't it fixed yet? You know, and then we get down, well, the maintenance was backlogged and they didn't get a chance to fix it. Well, why are they backlogged? Well, they've been short-staffed for the last 6 months. So if we find out this man fell, if we ask why 5 times, you're really realizing that the problem is not necessarily that he fell. I mean, that's a problem for him, obviously, but, you know, we're short-staffed and we need to get that fixed. Or maybe the next time something else is going to be a problem where maintenance can't fix something. So does that make sense? If you stop just at the fact that, you know, an individual fell and we helped him up and we tell him, be careful next time, you know, that's not going to fix the problem because the problem wasn't really his. It was other things that contributed to it. So the different types of causing contributing factors, I gave you 5 different whys, and each one kind of talked about different things, whether it be a people factor, an equipment factor, maybe it was an environmental thing. There are really more than one causing contributing factors, oftentimes with an incident, and it's not just the easy answer where he fell, we're told to be careful. It's what else? If we start digging, we can realize that there are multiple things that can go on in an incident, and if we can identify all of those and fix those, the likelihood of it happening again is a lot less. So these are just some examples. I know Connie talked about having some handouts for you with different tools that you can use, but the bottom line is making sure that you're taking these UI investigations just as serious as you would an MUI, and we're trying to prevent something from happening and getting worse. It's a big deal when somebody has an incident report because that means something happened to that person that could place them at risk. And we really want to focus and fix that before it becomes a big deal, a bigger deal. So I think I'm going to turn this over to Scott.
Sure. All right, well, let's talk a little bit about prevention plans. So to kind of recap where we've come, we've got an incident that happened. We want to make sure we've got a really good incident report, well completed, well filled out. We found out who the players were involved. We've talked to those players and got information from them. We've got any physical evidence that we think we might have, if the photo is necessary or not. We pulled information from the service plan, so really have a good understanding of that person. We've asked the 5 whys, and we think we've drilled down and we've got those cause and contributing factors that really led up to the incident. Now what we got to do, we've got to put together a prevention plan to try to keep that from happening again. So that's probably one of the most important pieces. You know, if we do a really good job up front and we've got good information, then this prevention plan is going to be successful. So you want to make sure you're looking at all those contributing factors. You want to take into consideration, as Kathy just mentioned, not only what happened to that person, but the systemic issues that may have impacted what happened to them. You know, the walker situation, the things that are maybe outside that person's control that may have contributed to what happened. So those systems issues that we need to take a look at and think about. There's certain elements that go, I think, into a really good prevention plan, involving the individual and their guardian and the team. I mean, obviously, if we have a situation that, you know, somebody's having increased choking episodes, someone's having increased falls, someone's, you know, become a missing person multiple times and they haven't been doing that in the past, really, really good idea to get that team together to talk about what other things can we do to try to prevent what's happening. I can't tell you how many times in the past, you know, a family member, a direct support professional maybe working, you know, 2nd or 3rd shift that really knows the person really well and has a great relationship with them, can offer information. Guardians always have good ideas or may have good ideas. Sometimes the, you know, administrators, you know, may have some opportunities to offer resources and ideas. So making sure that the SSA is there and has all the information so that the team can come up with a really good prevention plan to try to keep these things from happening. And probably one of the most important things is making sure that those plans are shared across settings. We've seen a lot of situations that come to our attention as MUIs that if the UI investigations had been done well and shared across settings, then maybe we wouldn't have had this situation come up. I'll just give you an example. The one that comes to mind is, somebody who has a diet change in their diet texture at home because they had a choking episode. We saw an MUI that came through where someone went to the day service, the day program, had a choking episode, and in digging and looking into it, found out that the day program didn't know that the home had changed the diet. It wasn't good communication. It wasn't shared. As a result, the person had a choking episode that may have been avoided had we done a nice job of communicating across a variety of settings. So I think that's really important. And making sure that everybody has a say. I think, our folks now more than ever, the folks that we support are involved in doing things at home and doing things at work and doing things, in the community and on the weekends and going out and doing things and just trying to make sure that everybody who's involved, have some say-so and some discussion about how we can kind of prevent this so we're not, developing these prevention plans kind of in a vacuum. Some other things is, Ohio is a technology-first state, and I'll tell you this, I know from personal experience and taking a look at outcomes on UIs, there are some times when technology could help you out. And I guess an example that I would give is, we had a situation I worked on where a person was having increased falls, and they were having increased falls at night. And one of the things that we had done was we had a monitor, an ability to monitor when the person got up out of bed, because that's when they were having trouble in falling, so that our folks knew exactly when the person got up, could be there to assist them so that they wouldn't fall. Even sometimes things as simple as, a night light, or maybe they have these beds out now where I've seen them, they're high-low beds where you can raise the bed up or lower it down if someone's fallen out of bed and you've had some UIs associated with that. You can utilize technology to maybe have a bed that might lower closer to the ground, so if they would fall out, they wouldn't be injured or harmed near as much. Just anything that you can think of involving people, involving technology, involving other kinds of supports. Just be as creative as you can be. I know it's really hard sometimes to prevent everything. Our expectation isn't that you're ever going to prevent everything. Our expectation is that you report what's happening to somebody, you take a good faith effort into what and why that occurred, and then you try to take some action to try to prevent that from happening. So clearly, technology and other supports can be very helpful. And I think this is important. I can tell you again from personal experience, you guys know me a long time. I'm willing to admit when I haven't done well, and I've had situations where I've had UIs where I've written on the back that I'll continue to monitor this situation. And in retrospect, looking back, I don't think I was going to do a whole lot different than what I did the day before. I was just going to hope that it didn't happen again, and that's not a good practice. You guys know that if we're going to prevent something from happening, we got to take some kind of action. And again, not that we're going to prevent everything, because that's not the expectation, but that we're going to make sure we get a good report, we follow up, and we find out what happened, how it happened, who were the players involved, and we put a prevention plan in place that's going to make sense. Now, for me, to put a prevention plan in that's going to make sense, you have to assign some accountability and responsibility to folks to make sure that it gets done. What that means is you can't just say that I'm going to train Connie and Scott, and we're going to close it out and we're going to be done. You have to say that I'm going to train Connie and Scott on the new diet texture that Steve has, because Connie and Scott work with Steve every day, and they need to know that new diet texture. And I'm also going to train Kathy and Connie on making sure that that Steve gets that attention during the meal, the supervision. A lot of things that happen during choking episodes have to do with supervision. People step away for a quick second. People think somebody's done eating, so they leave them unattended, and the person maybe grabs someone else's food or something happens. So specifics about what kind of training someone's going to have, when that's going to take place, who's the responsible person to make sure that it's going to happen, because then you're going to make sure that you're going to allow that to keep that from happening again. And sometimes that's hard, and you're just trying to get it off your desk, and you're just saying, hey, we'll continue to monitor, we'll train staff. We see a lot of UIs where that's on there, and it makes us really wonder what really has happened differently. What are we really trying to do to protect this person? So it's really, really important, and I think providers of service today in Ohio are doing a much nicer job of that. But I think we want to kind of reiterate the importance of what happens with that prevention plan in terms of assigning responsibility, when's it going to be done, who's going to do it, to make sure that it gets done appropriately. Documenting the investigation, you're going to implement the plan, to put the prevention plan in place, make sure that you document what's going to happen in terms of the outcome. So You know, I know we've got those UI investigations, and I've seen providers do it different ways, and all of it actually works, but making sure that you have a clear way of defining what took place, what work you did, how you identified the causes, and what we're doing to support it, and making sure, as Kathy mentioned, that you maybe have good information and maybe documentation to support that, because down the road, when someone asks you a question about it in 3 months, 6 months, a year, you may not know if you haven't got good documentation to support how you handled that situation. So making sure that that information is shared with appropriate team members for follow-up. As we mentioned, communication is key here to preventing across settings, to making sure all the disciplines within the team are well informed. Make sure the SSA and the Q are identified and have the information addressed in the service plan. It's not easy. Today, I've mentioned this to many folks, I think it's pretty hard to be an SSA and a Q today. There's a lot of responsibility. There's a lot of information that you are accountable for. But the better team you have, the better UIs you have, the better follow-up and detail you have, the better decisions you're going to be able to make based on risks associated with incidents that are happening to people. So clearly having that information available will be very helpful. And we kind of want to go through and just recap a little bit some of the information that we talked about. So you got an incident that happens, and remember, we really want to work hard in training employees right when they come into work on how important incident reporting is and how important doing a good incident report is, because that kicks off the whole process. If it's not done well, then you're kind of behind the 8 ball from the very beginning. So making sure that you have that good incident report, all the information is complete, we know who was involved, we know who we can talk to. Then we gather that information about the person through the service plan, through the behavior support information, through any information that you need to get, case notes, MARs, anything that you need to get, you get that. Now that you know who all's involved, you can conduct interviews and make sure you talk to folks. What did they witness? What did they see? Does that make sense based on the injuries that have been seen or what the individual reported? Do the descriptions of what happened make sense? If they don't, you can go back and check your facts and try to find some more additional information. Once you got all that detail, you can sit down and really delve into what were the causes of this incident. You know, I'm going to talk about falls a little bit because we're seeing a little bit of an increase here in Ohio in 2019 in falls and significant injuries as a result of falls. So an example I'll give you is Cindy went walking through the living room and she fell down. That's the incident report. Well, we dug a little deeper and we found out that Cindy was walking across the living room and she hooked her foot on a throw rug, a nice new throw rug that looked really nice, but she got her foot under it and it caused her to fall. Well, we dug a little further and we found out that Cindy had just had a pretty significant medication change that is impacting her balance. And then we did a little further digging and we found out that Cindy is getting older and we're not quite sure about her vision and she hasn't had a good vision check in a while. So we're wondering, so I guess, you know, to get back to what Kathy talked about with the whys, especially as it relates to falls or choking or something really significant, do your due diligence, do your research and try to find out what you can find out. So once we have that information for the causing and contributing factors, then we can go back and do that prevention plan. And we can say, hey, that throw rug looks really nice, but you know what? That's a fall risk for not only Cindy, but her roommate. So we're going to maybe find something else that looks nice, but isn't going to be the risk there. And we're going to make sure that that Cindy gets that vision check that we need. And we're going to make sure that we look into the meds that she's been receiving to try to make sure that what she has isn't impacting her balance or her gait. So that's just information we're going to take because we've done a good job of collecting it. We're putting it in the prevention plan, and we're going to try to see what we can do to try to keep Cindy from falling again in the future. We're going to document all that information. We're going to assign who's got the responsibility to take care of various steps in the follow-up prevention plan, and when we're going to verify that those things have occurred. So I think this is a nice slide to have when you're doing a UI investigation to kind of keep you on track with what you need from start to finish to make sure you've done a really good, solid UI investigation. Want to talk a little bit about trending. I think this is important too. We've seen some trends, and we want you guys to, through the UI process, to be documenting trends and looking for trends. As good as we do the UIs, it's only as good as we look at a holistic picture of the person. So each individual UI should be done well, but then hopefully all of you that are involved in looking into UIs can kind of take a step back and look at some trends, some house trends, some roommate trends, some bigger picture issue trends, so that you can help with some of those systemic issues that are in play that happen in every house. I mean, they happen in my house, they happen in your house, They're going to happen in the houses of folks that we support. And what can we do systemically by identifying any of those potential trends that come up? And in fact, we want to talk about some trends that we're seeing statewide that we want to make sure that you're aware of. One of the things that we talk about, and you guys, those who have heard us do webinars in the time, you know we talk about choking nearly every time. You can take a look at some of these numbers here in 2016, in 2017, in 2018. We had a lot of medical emergency interventions, and we had several deaths. You can take a look with incremental increases from 16 through 18 of 16 deaths in 16 to 21 deaths from choking in 18. And you guys know we talked about choking deaths being preventable and fall deaths being preventable. And we're going to talk a little bit about falls here in a minute. But I guess what I wanted to make sure I share with you is that the work that you have done, all of you, around choking over the last year has made a huge difference. In 2019, you can see that we've had 4 choking deaths. Take a look at those numbers. That's going to be one of the best years we've had in the last decade. And I think it's really because people have taken it very seriously. They've worked with direct support professionals to make sure they're well trained. They've worked with individuals to help protect themselves. They've thought about the foods that people are given. They've looked at the diet textures that people receive. They've thought through supervision during meals, and it shows. I mean, there's no way you get this kind of outcome without knowing that the work that you did is critical in making sure that people are safer here in Ohio. So really, really critical that we continue to do that. Prevention is the key. You know, you got to have good assessments and evaluations. And I know we're doing a better job. I know we're working. I know there's some work going on across the state on a single plan to talk about, you know, the good assessments and evaluations that we need. The team has to play a role. You know, we got to make sure that the team is involved here. We can only be as good as the group. And if we have a good team working on something, we're going to improve. Obviously, person-centered plans are going to continue to help drive positive outcomes for us, identifying risks and making sure those risks are addressed. Really solid training. I can't talk about this enough. We just had a statewide pattern and trend meeting yesterday, and training came up, and we talked about the importance of particularly a new employee today. You guys know that it's probably more challenging than it ever has. All of you know that to get and keep all the staff that you need. So the important piece is when those folks come in to make sure that they have the training they need to feel comfortable to do the job and feel good about the work that they're doing. So that training piece on the front end, we can't talk about that enough. And then obviously, you know, communication. You've heard me say that at least 2 or 3 times today. The more we communicate amongst ourselves within the agency, the more we communicate with those across all settings, the better off outcomes are going to be. I want to talk a little bit about falls, another trend we want to bring to your attention. So take a look again from 16 through 18, and you can see that we've had, you know, around 700 or over 700 falls reported as significant injuries. And you guys all remember, if it's a significant injury, that means there's been a laceration. That means there's been a really significant injury or broken bone to that person from that fall. And the reason I share this is if we have this many MUIs, just imagine for a minute how many UIs we have related to falls. And imagine how many opportunities we have to prevent MUIs from happening if we do a really good job of that UI investigation up front when people just get a skin knee or a bump or a bruise, and we're really looking into why that happened. So the work that we do up front is incredibly important to impacting this overall information related to falls. Year to date in 2019, and this is kind of the alert I want to throw out to you, and I want you to make sure you share with the folks that you work with and the folks that you support. We've had 13 fall-related deaths so far in 2019, and you know, we're now in December. You can take a look at 2017 and 2018 and see that we're trending upwards, and we got to do a good job of really identifying, you know, some of those risks associated with falls, so we can do a better job of preventing those. So again, choking's got to be a priority. Falls have to be a priority for you. And kind of the last thing I think we want to talk about is transportation as well. We've seen some significant trends in transportation-related issues. One of the first that pops out for me is that distracted driving. A lot of issues being reported to us, and we're seeing about people texting while they're driving, talking on their cell phone, not paying attention. You know, we got to do better than that. You know, people aren't just driving themselves around. Most of the time, there's 3 or 4 or 5 people that are there that you're responsible for. You know, you have to make sure that you're on your A game when you're driving, and you're responsible for multiple people during transportation. We've even seen some cases of people driving while impaired with alcohol or drugs. So that's certainly really important. people being left off at home or at work when there's not the supervision that somebody needs. So we got to make sure we keep track of that. We're going into the winter months now. We're going to get into some extreme cold weather, making sure that people aren't left unattended, you know, in cars in really, really cold weather. We had some tough cases this summer, people being left in cars when it was an 80, 90-degree day, windows weren't down. That's significant risk. And we had some people that were hospitalized as a result. Been seeing a lot of wheelchair and lift-related issues too. So wheelchairs tipping over, people coming out of wheelchairs where they haven't been secured, those kinds of things. So we gotta make sure. I know people are in a hurry and I know things happen, but man, when you're taking somebody out on the road, make sure that you're safe and secure, make sure they're safe and secure, and make sure you're paying close attention to driving while you're out there, because we've had some tragic cases reported across the state over the last year. We want to certainly avoid that at all costs if we can.
Okay, well, just in a little bit of a wrap up, we have taped today's webinar. In the next slides that follow, we've included some frequently asked questions that will talk about some things that people have asked previously through our trainings about unusual incidents and those investigations. So we wanted to include those resources for you. We also wanted to make sure that you're aware of the Health and Welfare Toolkit, which is on DODD's website. If you go to the bottom banner, it says Health and Welfare. You can click on that. You can find all the health and welfare alerts that have been issued for this year and previous years. You can also find videos that you can share with your staff for training. And also we have guidance documents like frequently asked questions and different resources. We will include a section there in the weeks that follow on unusual incident investigations, and we will include all the resources that we've shared through email with you today. And now we have a couple questions to wrap up, and so we'll ask those of Kathy and Scott here. And the first question is, would you please give an example of what you would consider an unusual incident for an unapproved behavioral support situation?
Well, what you can do, when we're talking about an MUI, there's got to be a risk of injury. So if Connie is hitting the table and I put my hand on Connie's hand and she's not resisting me, that would be an example of a UI. Because now if she starts, you know, fighting back, where there's anytime there's like type of a resistance, then there's potential for injury. So that would be an MUI. But if she's not and she's just kind of following along, or I kind of escort her, hey, let's go to, you know, over here, and she's not being combative and she's walking with me, that would be an example of a UI.
I think I agree, and I think that some of those could be like, you know, when we talk about some of the client rights issues and some of those kind of things where things happen to folks when there's not really risk or significant risk to the person. I think that's kind of the difference, you know, you get between a UBS and a client rights that might rise to the level of a UI or an MUI.
Great.
Good question.
The next question, and I can field this one, is where can I find a copy of the rules? And that's a great question. So basically, you're going to go to our website at www.dodd.gov, and you will be able to go to the bottom banner, and you will see something that says, a link that says Forms and Rules. If you click on that, you can go to all the rules that are in effect now, and our rule is at the very bottom if you scroll down, and you can click on that rule, and you can also go on our website and subscribe to any rule updates. So if you're interested in knowing, you know, a rule is going to be revised or there's proposed changes, you can get notifications through our website. You can also go on our website and subscribe to get subscriptions to abuser registry notifications, health and welfare alerts, and other DODD publications. So please feel free to go to our website, check it out, explore around. If you're not familiar, we also have a DODD YouTube channel, and we have multiple trainings and short videos that will better inform you of things that are going on that are MUI related, and there's a lot of great helpful information about other areas as well. And you can find that by going to YouTube and typing in Ohio Department of Developmental Disabilities, and you'll see the channel with multiple listings there for the videos that we've posted there. So hopefully those will be some good resources and tools that you can share with your staff. Finally, we have a couple more questions. So the next question is, what is the SSA's role in an investigation, or is the only thing they do adding any risk to the ISP?
So, you know, I guess depending on the provider of service, obviously, but the SSA as the team lead, you know, certainly is going to need information from the provider, from the team, to help guide the team process and be able to come up with information within the plan for prevention. So I guess I would say twofold. The prevention plan comes out of the review of the UI and what you think as a provider agency in cooperation and communication with the team can improve that. The SSA's role, I think, would be to capture some of that information to make sure that those risks are identified and to make sure that the team has discussion ongoing for whatever kind of UIs happened over the course of the year for that person, or, you know, from the last team meeting or whatever you decide to do.
And I just want, when this SSA is not doing the UI investigation, but you are going to be looking, if let's say you review that and you want to look at that UI investigation for whatever reason, when you look at that, it's really important that, does that make sense to you? You know, what you're reading, is there enough information? If not, then maybe, you know, additional follow-up needs to be done. So it's no different if you're the person, you know, a provider agency, that the supervisor that's reviewing the UI investigation, or if you're the one doing the investigation, whatever the case may be, that should make sense to you. I mean, it shouldn't be any blanks like we're missing this spot or wonder what happened here. You know, everything should be making sense. So that's another important role. And if you're the IA also, and you have an MUI now for falls, you know, you may be reviewing UI investigations of the last 6 months of falls. You know, what was the prevention plan? Did it make sense with what that investigation is? So, you know, you have a very important role to make sure that you are checking checking the investigations if they're relevant, and you're involved in that. So, you know, don't just say, well, I don't do UI, so this is not relevant to me. It absolutely is relevant. So just making sure that you pay attention.
Great. And there's a couple of people had some questions about, you know, what is the role of the independent provider when it comes to conducting investigations for unusual incidents? And we believe, you know, obviously the rule clearly spells out if you're an agency provider, you have that responsibility, but we also strongly believe that if you're an independent provider, you play an important role in this investigation. I think you can collaborate with the team to look at things that, you know, obviously you're going to report and make notifications, but you're also going to want to make sure that you're working together to try to determine why something happened. And so as the person that is working as an independent provider, oftentimes you're the person that knows that individual best. And you are critical in this process, and we have to make sure that you feel comfortable kind of trying to identify why things happen so we can work on prevention and share that and facilitate those discussions with the team. So whether you're an independent provider or agency provider, you still play an important role in this investigation. And some other questions that we've had. Does the county board have a responsibility in assuring providers are appropriately completing investigations of unusual incidents?
I think through their oversight process and looking at logs and looking at UIs and investigating MUIs, certainly they're going to see, and they certainly do have and should play a role in trying to make sure that good, thorough investigations happen at the provider level. I think it goes back to what I said earlier. This whole process is only successful if there's good communication, if there's good cooperation, if the board's working closely with the provider to get that done. So, you know, in my mind, there certainly has got to be that oversight piece by the board, and even more importantly, that collaboration by the board in assisting the providers and the teams to come up with prevention plans and follow up the UIs that make sense.
Great. Wonderful questions. Another question is the provider required to write an incident report if they become aware of something and they weren't working with the person at the time?
Well, that's a good question. I mean, I think best practice for us has always been, and what I always said, if you're in doubt, you know, go ahead and write it up. It's not going to hurt anything, especially if there's a risk to that person or potential risk to that person. obviously the responsibility for the provider is on reporting and following up. If it happens when you're there with them, there's no question about it. If you're notified of something, then your responsibility probably isn't as significant, but for me, I want to make sure that folks still write it up, still communicate to the board to follow up to see if there's additional action that needs to be taken.
Great. And then the last question that we'll take, because we're at time, is the rule talks, the programmatic implementation definition talks about self-reported incidents by a staff person. Can you give an example of that?
Well, one example that came to mind is, let's say a staff, and actually it's probably even in the example they gave, somebody requires, one-on-one supervision, or they have eyes-on supervision, and it's 3 o'clock in the morning and the staff dozed off for 5 minutes. We had I remember one case where it was on an ICF, and the individual needed to have their own one-on-one. The staff had to use the restroom, but there were 2 other staff in the hallway, and they said, somebody reported, or actually she reported, I don't know what to do because she was getting sick, and they self-reported it that she left the one-on-one. However, it didn't rise to a neglect because the supervision was really there with the other 2 staff. So that kind of makes sense, but
there are actually situations where people do self-report, and obviously, those are conscientious people that care about what they do, and so most of the time it is, I nodded off, or this didn't happen. That's the majority I know of the examples of self-reports that we get.
Okay, I think we're at time now, so I'm going to have Scott wrap up with any final comments. And if you have attended this webinar by group, please complete by typing in the Excel spreadsheet and sending that in so you get a certificate. And if you've logged on as an independent person just watching by yourself, you don't need to do anything further. You will get a certificate emailed to you within the next 30 days. So Scott, in wrap up.
Absolutely. Yep. I just want to thank everybody again for participating today. I know we got through a lot of stuff in an hour's length of time, but I want to reiterate what I said earlier. We've got a really, really good system in Ohio. We've got a good critical incident reporting system that involves reporting of MUIs, that involves the reporting of UIs. We've got distinct responsibilities by the board and by providers to follow up on those cases, and I'm excited about the work that people are doing. This was a great opportunity for us to, again, share more information about UI investigations. How can we improve them? How can we make them better? I know that moving forward, we're offering opportunities to improve outcomes for people at the UI level, at the MUI level, at the systematic level. And at the end of the day, it's all about protecting those that we're entrusted to support them. And I want to thank you guys for the work that you do. I want to thank Kathy and Connie for helping with the webinar today. We hope that it's been helpful for you. And again, remember, it's recorded and it's there. If you want to share with your staff at a staff meeting or some other time that you want to get it out, you're welcome to do that. But thanks for the work that you do, and we appreciate it.
Thank you.
Thank you.